There isn't anything adversarial about it, because as soon as I start asking the questions, how do you know if it's this or how do you know if it's that, and the client hears themselves say, again, that deer in the headlights look of, I don't know, all of a sudden they realize here is a vital piece of information they don't have, and all of a sudden they become incredibly clear incredibly quickly that I'm playing, I'm responding with one hand tied behind my back. I'm trying to make decisions without having a reasonable way of making the decision, and it opens the person up to learn. And if you watch the session with Mike, my interview with him takes about 5 minutes, and then I move into a psychoeducational mode of, here's what you've been trying to do, here's the way that you've been approaching it that hasn't worked. You don't know what else to do. I'm going to teach you what else to do. And you'll notice his quality of attention. He is riveted on me. And by the time I start the hypnosis session with him, honestly, if he could have sat in my lap, he would have. And so I take a look at how strong the therapeutic alliance is and ask yourself the question as a viewer, how did that alliance get built? I didn't do the usual things of feeding back deeply empathetic statements of, oh, you poor guy, gee, no one should suffer that kind of abuse at the hands of his father or anybody. I didn't do that. And yet, literally, he would have sat in my lap if he could have by the time I started the hypnosis.
And so, in your experience in working in this way, so what is it that if you were to characterize what you've gleaned from your client's response about what they're appreciating about it, and what they bond with, it's not a unconditional love and everything is okay. How would you describe it?
The problem goes from abstract and undefined, and therefore seemingly hopeless, to something that is concrete, defined, learnable, that is empowering. And people respond to that incredibly quickly. The whole thing, of course, when you're dealing with people who are depressed is they tend to have an external locus of control. They tend to feel pretty powerless about things. And the emphasis is always building an internal locus of control. How can I help you develop the skills you need to live life in the way you want to live life? To make better decisions, to have better relationships, to appreciate yourself better, to be able to recognize and amplify your strengths, and all the other things that make people feel better about themselves and better about life.